This is today's news conference on July 13th, 2010. The AIDS Healthcare Foundation will discuss its response to the White House National AIDS Strategy. Live coverage from the National Press Club.
So we're here today to respond to the National AIDS Strategy that is being put out by the Obama administration. It is not a strategy. You go to Webster's dictionary, it says the science or art of war. You can't fight a war without resources. Not only does rationing care to HIV patients hurt those people, but it sends a terrible message to the people we want to get tested. Why should someone get tested if they won't have access to care?
I stand before you today as someone who has been living with HIV for 8 years. I stand before you today as someone who has actually been on the AIDS Drug Assistance Program at one time in my life. And unfortunately, I address you this afternoon conflicted by a feeling of accomplishment battled with a sense of defeat. The very moment we should be celebrating the first ever national AIDS strategy in the United States, we find nearly 2,300 Americans living with HIV/AIDS that we are aware of, waiting to access their life-saving medications.
In dealing with this strategy and creating this strategy to be implemented sometime in the future, the administration unfortunately has ignored the crisis today. And that's what's so critical about fixing the crisis today so that we have the ability to go forward.